The federal government has partnered with private health institutions to make cancer testing, treatment and management accessible by launching the Breast Cancer Access Navigation and Testing Program app. Now this, according to the Director General, National Institute for Cancer Research and Treatment, Usman Aliyu, would bridge the gap in fostering accessibility, affordability and treatment of cancer in Nigeria. Health experts say innovative technologies and AI are key in advancing cancer treatment. They also tasked the government, that's the federal government, to ensure collation of data for patients living with the disease to determine which cancers are attributable to lifestyle, the environment and genetics for referencing and research purposes.
We are launching the Breast Cancer Access Navigation and Testing Program, BRANT. And it is a transformative initiative to reshape breast cancer diagnosis and treatment in Nigeria. Our goal really is to shorten diagnostic timelines to under 60 days, improving survival rates and the quality of life for patients.
The BRANT program is founded on three key pillars, providing 8 benefits. And if you look at the name BRANT, the last 3 words, access is the first pillar, the second pillar is navigation, and the third pillar is testing. And under those 3 pillars, there are 8 benefits. Our goal is that there will be more benefits. In a few months, more people will, share ideas of how to better serve our patients, and we will then be able to add more benefits.
Moreover, the digital application bridges the gap in communication between patient and healthcare providers, and it enables patients to track their appointments, receive reminders, access educational contents and information about their condition, and connect with support groups, more especially in the areas of mental health and counseling. Patients will no longer feel isolated in their journey. They will be equipped with tools and resources they need to make informed decisions about their health and well-being.
We're joined now by the Minister of State for Health and Social Welfare, Dr. Ishaq Salako. Thank you so much for joining us on Newsnight tonight. Well, talking about cancer, I mean, it's quite, troubling when you hear that misdiagnosis kills 70% of, cancer patients in Nigeria, and the same applies to so many other ailments in the country. And this integrated diagnostics couldn't have come at a better time. Tell us how this will really change Nigeria's health sector for good.
Thank you very much, and it's a pleasure to be here. Thank you for having me. Integrated diagnostic is an evolving concept, really. And when you look at the diagnostic space, you see that it's either you're talking about laboratory diagnostics, talking about imaging diagnostic, where you do x-rays, do scans, do CT scans, and so on, or you're talking about pathological diagnostic, where you take tissues and you look at them under magnifying microscope to look at it. Now, at the moment, in most part of the world, not only in Nigeria, you see that each of these professional cadre within the diagnostic space operates in silos. If you go to an hospital, you have to go to the laboratory to go and do laboratory tests. Then you have to go to the x-ray room to go and do x-ray. If you need to do pathological tests, you have to go to the pathologist to go and do that. Integration means that bringing everything under one roof. What that means is that first, it's shortening the time that you need to go through to do diagnosis, and also helps the clinicians to get the results more quickly and be able to integrate the outcome of that result. In addition to that, integration also means bringing the power of digital technology and AI into it to help you interpret the results better. And as a result of that, by the time, for example, if you start accumulating results using AI, a time will come where AI can be the one that will also help you to direct your attention more quickly, because a pattern is now formed. Right. And then you can direct your attention more quickly, that the way this thing is looking is like it's going to be like. So when you have such kind of template, it quickens response to treatment and improves outcome for patients.
Definitely.
So that is basically the essence of integration.
Fantastic. But at the moment, we do know that the private sector plays a huge role when it comes to diagnostics in Nigeria. And when you talk about private sector, you're talking about profit. So it makes the test expensive. That leaves a huge amount of Nigerians who need this test to be quick and integrated, as you have highlighted. So how are you covering that gap? Because a lot is still in the hands of the private sector.
Well, you see that if you saw what happened on the first day of the National Summit on Diagnostics, where and I was there, and you see the very huge presence of the private sector within that space. The health sector generally is significantly regulated. Yes, private sector is allowed to make profits, but with the increasing penetration of insurance in our healthcare system, there's going to be some level of regulation of pricing. Because what it means is that there will be pre-negotiation. You know, when you do an insurance, there's already a negotiation about it. If you do HP, you'll have negotiated that HB PCV test is going to cost this. If you're going to do scans, you'll have negotiated that it's going to cost this. So that pre-negotiation will tend to control the kind of pricing that can be implemented. But of course, that is not going to happen overnight. With increasing penetration, more resources available within the health sector in terms of financing, then it will be easier to negotiate pricing and reduce.
But is that part of the plan to make sure diagnostics are accessible to more Nigerians, or majority of Nigerians, who hardly have the economic wherewithal, to approach this huge private sector, health facilities. Now let's talk about manufacturing of diagnostics equipment in Nigeria. That came up in that report. What exactly is the plan for that? Because I mean, for you to have a manufacturing sector that provides for the health sector equipment and what have you, you have to have a viable. Take for example the Ajaokuta Steel Complex. Nigeria does not produce any injections, for example, the syringes and what have you. What's the deliberate plan in that direction?
Well, I must tell you, actually, we do produce the syringes in Nigeria.
Oh, great. How long ago now? Because the last time I checked, why not?
The challenge that has existed is that sometimes the syringes that are produced locally are a little bit more expensive than those that are brought in, especially from the eastern part of the world. And because of that price differentials, it creates the affordability challenge.
Right.
But there are companies producing syringes, and that is why the executive order that the president gave sometimes last year was to reduce the tariffs so that we can bring down the cost of some of this local produce. In addition to that, you also recall that the president has established the PVAC office, which is an office to unlock the value chain within the health sector. Now, if we are talking about the value chain, it includes diagnostic. In fact, diagnostic is a major part of the value chain in the health sector. And that PVAC office is to work with potential investors, ensure that we're able to assist them whatever way necessary in terms of licensing, in terms of land issues, in terms of creating all the enablement that that can encourage them to establish manufacturing plants in Nigeria. So at the moment, you see that, for example, I don't want to mention companies' names, but right now in Nigeria, now we are assembling test kits for HIV.
Okay.
We are manufacturing glucometers that is used to test blood sugar. A company is already showing interest in the assemblage of ultrasound scan machines. So when we start from assemblage, we can then gradually mature to manufacturing.
Great.
So that is the kind of plan. And yes, the ultimate goal is that within the next half a decade, Nigeria become a hub for healthcare manufacturing, at least in the continent.
Fingers crossed. Half a decade is almost here, Honorable Minister. And I do know that the Federal Executive Council did set aside some 10 1 billion naira recently, part of which is for local manufacturing of this test kits you talked about. So we're watching the space, but let's talk about some other things happening in the health sector. Lagos is currently experiencing an outbreak of diphtheria. What can you tell us about that? Do we have the capacity to handle that? Some have said is the lack of vaccination gaps that is happening that is causing this. What's going on in Lagos, and can we handle it?
I think that the Lagos State Government Health Authority has responded very well to the outbreak. The outbreak is in a school, which is like a close community, as it were, and they've responded by intensifying the level of vaccination that is made available, and they have also used that school as a form of isolation centers so that those who may have the disease do not necessarily take it to the community, and the neighborhood around that place too. Vaccination is being intensified. The truth of the matter is that for such infectious diseases, and I must tell you that it's not only happening in Nigeria, because when you vaccinate, sometimes the protection wanes over years, you know, and you only need one person to reintroduce the bacteria into the community. So that's what has happened in Lagos. But I am satisfied with all the interaction that we've had with the Lagos Health Authorities, that the approach, the response.
Is it curtailed? Is that what you're saying?
Yes, at least so far it is restricted within the outbreak within the school. That's the latest update.
That's good to know, but you know, when diphtheria, you know, some of these diseases were thought to be a thing of the past, and all of a sudden they're coming back.
They are not.
Okay, now we're facing meningitis and all of that. What's the plan, you know, for all these diseases to ensure that they don't, you know, get totally out of hand? Meningitis, there's Lassa that's continued to, you know, plague Nigeria. Well, what's the plan in that direction?
You will find out that first, the Nigerian Center for Disease Control is the federal government agency in charge of health security.
Yes.
They conduct surveillance, monitoring, and response to infectious diseases when the outbreaks occurs. And they have been able to establish in most states of the country emergency operations centers that is able to respond immediately when there are outbreaks of such infectious diseases like Lassa fever, like meningitis, like cholera, and so on and so forth. So the approach is continuous monitoring and surveillance, so that you can catch it very early. Once you catch it very early, then you can take measures to restrict it to a very limited area, and then do case management. Those who have contacted the disease, you can and of course, those diseases that are vaccine preventable, we continue to encourage vaccination. Governments continue to spend a lot of money on ensuring that vaccination program.
Minister, we're told to wrap up in 30 seconds if you can, because this is very important. It's a large workforce. Nigerian nurses and midwives. Just yesterday, you were appealing to them to not excessively use the tool of downing tools. Yeah. But what other option is left to the Nigerian worker who has been pleading and begging, you know, to be given what is due to them, working conditions, and all the areas they ask for?
Well, today I was also with the Joint Health Sector Union, which is a coalition of unions within the health sector. And yesterday I was with the nurses, like you observed. And the truth of the matter is that strike, yes, it's sometimes inevitable, but I believe that the way we use strike, particularly in the health sector, is not too disciplined, and we need to take a second look at it.
But what are you doing to address their demands?
Yes, you see, the fact of the matter is that the government continue to respond to the demand of workers. And today, if you bring out health workers from the civil service, you will see that health workers are one of the best paid workers in Nigeria today. Perhaps it's only judges
they will agree with you on that, and that's why they
that is the truth. If you go to you are a journalist,
yes.
So you go and do your investigation. Take a level 8 officer who is not a health worker.
Right.
Take a level 8 officer who is a health worker and compare the salaries.
What does the average medical doctor earn in Nigeria?
Unfortunately, I cannot tell you.
Why you say they are the best?
No, compared to any other health worker, it would be the economic context and affordability of Nigeria.
All right.
They are the best.
All right. Okay. We'll have to leave it there. Thank you very much, Dr. Ishaq Salako is Minister of State for Health. Thanks for joining us.
Thank you.
It's my pleasure.